Congenital heart diseases. So before we get going, we're just going to recap how the blood flows normally through the heart. So it's going to come deoxygenated from the body into that right atrium to the right ventricle and then off to the lungs to get reoxygenated. Oxygenated blood is going to come into the left atrium, left ventricle, and then go out through the aorta to the rest of the body to bring oxygen to the tissue. Unfortunately, not everybody is born this way, and that's how we end up with congenital heart diseases.
So I'm just going to talk about how prevalent this disease is, and it is present in about 1% of the U.S. population, and 25% of these babies have a congenital heart disease that have a critical defect. And within those babies, about 95% of them are expected to survive to 18 years of age.
So, what are congenital heart disease? So it's actually just abnormalities of the heart or the blood vessels around the heart that are present at birth. About 90% of these cases have no known cause. However, the other 10% of the cases are due to environmental or possibly even genetic factors. It's actually 60 times more likely for your baby to end up with a congenital heart disease than it is for them to be born with cancer.
And so there are two classifications of congenital heart disease. One is cyanotic heart disease, where you have decreased pulmonary flow, meaning that your baby is not getting oxygenated blood to their body. And then most common one is a tetralogy of Fallot. And so for acyanotic heart disease, you can hear it in the name, this does not affect the oxygen level of the baby. So you're going to see a left to right shunt lesion, and a common example of that would be ventricular septal defect.
Okay. About acyanotic diseases here, the most common one we just talked about was the ventricular septal defect, which just is a hole between your two ventricles. So instead of your blood being oxygenated coming out to that left ventricle and going out the aorta, it actually makes a detour through this hole back to the right ventricle and just gets pumped back to the lungs. So the heart has to be working twice as hard to get the blood, because it has to be pumping twice as much blood to get enough blood out through that aorta. Imagine it being like going around a traffic circle 20 times before you get off on the correct exit. It's just a not very efficient system. But usually it's kind of asymptomatic because it's just oxygenated blood getting recycled, so you wouldn't have any hypoxic symptoms.
And so the next topic we're going to touch upon is the cyanotic congenital heart disease. So what happens in this one is that your baby is not getting enough oxygenated blood to the body. So like the analogy we were talking about, how the car keeps going around the roundabout. Well, in this case, it's going to bypass the lungs and just get off of the roundabout and just go somewhere else. So what's going to happen is that it's going to desaturate the left side of the heart. So you're going to see a right to left shunt in the heart. And a very common example of this would be a tetralogy of Fallot.
The blood is just going to pop straight from that right ventricle, not go up to the heart, and it's going to pop right into that left ventricle and go out to the body without being oxygenated. So your oxygenated blood and your deoxygenated blood are going to get mixed together, so it's just not enough oxygen to your body.
And so this is dangerous to see in babies because you're actually going to be able to see it very visibly in the babies. So their eyes are going to turn blue, and you're going to see that their tip of the tongue is actually blue too, and so will their lips be as well.
Okay, so how does this relate to the top 20 patho that we've been talking about in class? Well, the number one thing is probably going to be the murmurs, because congenital heart defects have issues with stenotic valves and stuff like that. However, you can't diagnose a baby with CHD based solely on the presence or absence of a murmur. However, the nature of the murmur, if it's harsh or blowing, along with the other heart sounds, is useful in differentiating between mild defects and severe abnormalities. Also, the age of the infant when that first murmur is heard is also very helpful. So, CHF, like we talked about, congestive heart failure, is the primary concern of that acyanotic congenital heart disease, because the heart is working overtime just recycling that oxygenated blood because it's an inefficient system. Whereas hypoxia is that main concern with cyanotic congenital heart disease, because the body's not receiving that oxygenated blood. It's receiving unoxygenated blood because it's not getting up and going through the lungs.
So to recap what we've talked about, the main points of this is that congenital heart disease comes in two different categories. It would be acyanotic and cyanotic. Acyanotic, you would see that it has the left to right shunts where it goes from high pressure to lower pressure, and that oxygenated blood is just going to keep getting recycled in your body. And a common example of that would be the ventricular septal defect. And so the primary concern of acyanotic congenital heart disease would be congestive heart failure, and just saying this again, it would be like oxygen level remains unaffected. And to relate it back to our topics that we've gone over in class, the outflow obstruction can be seen in pulmonary stenosis or aortic stenosis, as we know as murmurs. And then the cyanotic is when your baby is not getting enough blood to their body, so they're going to be hypoxic. And a common example of that would be tetralogy of Fallot. And these are our references.